Hi, everyone. It's Chelsea here at the Animal Welfare League of Arlington, and I have two very special guests today. One of which is Dr. Galati, our staff veterinarian. He's with us, and he also has a little friend in there. She's not on camera right this second, but we are here with Cricket. Hi, Cricket. And
Man.
for those of you that are regular visitors to our page, you might notice that Cricket looks familiar. Her name used to be Kale or Collie, and no one knew how to pronounce it. And we decided we should change her name to something a little bit cuter and easier to pronounce. So her name is now Cricket. So we're reintroducing her to the world. But we are here with Dr. Galati today to talk about Cricket because she does have a condition called diabetes. And who better than to tell us all about what that means and how to treat it and answer any questions you might have than our awesome staff vet. So Dr. Galati, do you just want to introduce yourself real quick and say hi to everyone?
Oh, sure. So I'm Matt Galati. I'm the Chief Veterinary Officer of the Animal Welfare League of Arlington. I'm the vet on staff. That's what that title means. So I provide all the surgical and medical services for the guys here. So to the best of our ability, we try and treat everything that we can in-house, or we help coordinate when they need special treatments elsewhere.
So you are the one to answer these questions. You're the expert.
Tell me.
Well, hopefully we'll be good. Won't make it too hard for you. But yeah, so we wanted to do this just because we do get a lot of questions when we have diabetic cats. We do have diabetic cats more than dogs, I think. Hi, sweetheart. And people always have questions, understandably. Oh, hello. Are you sniffing, everyone? Are you saying hi? She wants to come through the phone to you guys.
Yeah.
People always have questions. People always have concerns, which is totally understandable. So we thought this would be a good opportunity to kind of go through those questions so that everyone can learn, and whether or not they have a diabetic cat or they might think about adopting Cricket, we can kind of go over this stuff. So I guess we'll just jump right in. Cricket is, well, and I guess I should talk a little bit about Cricket. She is female cat, she's like middle-aged, right? I think.
When she was brought in, it was estimated she's probably somewhere between like 6 and 8 years old. So
Okay.
we think she's like definitely a mature adult. We think a little bit older. If she's a
Yeah.
person, we'd say she's probably in her like mid 50s. That would be a
Okay.
fair guesstimate.
And 50 is the new 40, so.
Yeah.
Well, can you tell us, just for those of us who may not know what diabetes is, what exactly is diabetes and how do cats get it?
Sure. So her condition specifically is called diabetes mellitus. So when we talk about diabetes, it means that you are urinating too much. You're drinking and urinating too much. That second word mellitus is why. So that's actually like it's the Latin word is sweet. So it relates to excessive blood sugar. Poor blood sugar control in the body leads to excessive thirst and urination. Now, it causes other problems, but that's the short version, in that you're peeing out excess sugar, and as a result, you get very, very sick from that. There are a couple other forms of diabetes that are not related to blood sugar at all, like diabetes insipidus, but with Cricket, I almost called her Callie.
I know.
She has the more classical form. It's the more common form that we're going to see in people and in animals.
Why are you so grumpy? She said, don't talk about me like that.
I'm not alone. The blood sugar's fine.
Cricket. Oh, you have a low blood sugar. This is what happens when we do live interviews, you guys. Just never know what's going to happen.
What do? Hold her tail. Like, no, she's hitting me with her tail. I'm just sitting here.
Cricket, you're so grumpy. Well, anyways. So, what was my second part of that question?
Going back to
are you getting a treat?
A toy. No treats because she's been putting on.
Oh, that's right. No treats. Yeah, good point.
Yes.
So yes. What was the second part of my question? Oh, how do cats get diabetes?
So diabetes is an acquired condition. They don't get it through infections. They're not usually born with it. Cats get a form of diabetes that we would, in people, call type 2 diabetes. So with this disease, what we found is that you are either not making enough insulin. It's the hormone that helps you process blood sugar. So you're either not making enough of it, or you are not responding to a normal amount. So type 1 is I'm not making it. Type 2 is I have insulin in my body, but I'm just not responding to it normally. overwhelmingly, most cats seem to fall into that type 2 category, that it's a later onset thing. Dogs and people with type 1 get it earlier, or as like juvenile diabetes. When you get it as a middle-aged or a senior cat, typically it's because for whatever reason, your body's not responding to normal insulin signals. So when we treat these guys for it, what we try and do is we give them extra insulin. So all diabetes mellitus is treated with insulin. The mechanism for why you're sick is different, but you're treated in a very similar way. So we give her extra insulin so that any receptor she has for it, we can really saturate them. We can get them all hit with insulin. And hopefully with better blood sugar control, with type 2 diabetes in cats and in people, if you treat them and get them really, really finely controlled, you may be able to stop insulin for a while. So that's kind of the hope with these guys. We can put them into a remission from diabetes for a little bit.
Awesome. That's great. Well, I know you kind of touched on my next question a little bit already, but other than excessive urination and excessive thirst, what are some other symptoms that a cat with diabetes might exhibit before they're being treated?
For sure. So the thirst and urination are always the big things we look for because they're not subtle. They will be having lots and lots of those things. Other things we'll see is that they will typically have a really big appetite. So they're going to be asking and begging for food all the time. So unfortunately, that's the cricket is over here wagging her tail and looking at
Is
the door.
that why you're grumpy, Cricket? Are you hungry?
Yeah.
Aw.
She was swishing her tail, like looking at the door, waiting for. She thought I was
Oh,
going to
she
attack,
probably
and now she's
thought
like,
you
"All right,
came
you
in.
did to me." So I give her her little parrot here, and she's like, "That's not what I want, you know."
No. She probably thought you came in to feed her, and now she's
Yeah,
like,
exactly. She was my
"Yeah."
buddy 2 minutes ago. I'm letting him feed her. She's like, her back is turned to me, and she's like, "Don't look at me."
I mean, to
So
be honest, we've all had the hangry before, so I
understandable,
sympathize.
right? I mean, we're a snack connoisseur now since we're all trapped inside.
Yeah,
So
exactly.
increased appetite. Most of these cats will have weight loss as well. They will have unexplained weight loss, meaning they'll lose probably 10 to 15% of their body weight. And then when you go to your vet, you're like, oh, my cat's normally 10 pounds. She's 8.5 now. And I wasn't trying. She's eating like a little piggy. I give her all the food she wants. She's still losing weight. So when we see these things, again, you can eat and eat and eat. But if your body cannot process that sugar that's in your blood, that glucose, it's kind of ineffective. The food's just being wasted. You eat it and you pee it all right back out. So
Or little things. That doesn't sound very fun.
yeah.
Well, I think a big question that we get a lot of the time, which of course none of us ever want to think about, but it's an important question, is do cats with diabetes have a shorter than normal lifespan, or is it just completely normal compared to other cats?
Gotcha. So it's a difficult question to answer. I'd say with good control and regulation, and especially if we could put your cat with diabetes into remission, they have a decent quality of life and quantity of life. We'd expect them to lead pretty normal lives. Most cats, when you're looking at your domestic indoor cat, again, for these guys to be 12 to 15 years old with no health, that's pretty normal. We expect these guys to be teenagers, to some extent, before we really think they're going to be very, very old. Having diabetes makes treating other diseases more complicated. So I'd say on average, it does probably shorten their lifespan a small amount, but most of these guys typically get it as middle-aged or senior cats already. So it would be weird to have a 2-year-old cat with diabetes. You're typically diagnosing this in cats who are like, 7, 8, 9 years old at the youngest, or even older. So in Cricket's case, again, we think she's 6 when she came in, but based on some other things, she may be a little bit older. She may be
Okay.
8, 9 years old. So a lot of these guys, again, I don't think life expectancy has changed a ton because we're normally finding this in older cats to begin with. So for them, I'd say it will make treating things like cancers or autoimmune diseases harder because there are certain medications you don't want to give a diabetic. But you wouldn't expect it to dramatically shorten their life. It's not like she was going to be 16, and now she's only going to live to be 6.
Yeah.
It's nothing that severe.
I have to say, I'm enjoying that, like, she decided, like, I don't want you to talk about this anymore.
I'm going to sit in front of the
I
camera.
am going to sit so you cannot discuss these things. Well, okay, Cricket, we'll move on to a slightly happier topic. And so speaking of Cricket, for her specifically,
Yeah.
how are we treating her diabetes right now?
So we're using an insulin called Vetsulin. It's a veterinary specific one. It's made for dogs and cats. And we're giving her injections twice a day. So normally we time it with their meal times. So we give her breakfast and dinner. We try not to give her a lot of snacks and treats during the day because that will cause blood sugar spikes. So we want to try and keep things as regular and consistent as we can. And then essentially, like while she's eating, usually like 10 minutes after she's done eating, we'll come by and give her her insulin shot.
Okay.
It's very important to make sure these guys eat when you give them insulin, because if they don't eat and you still give them that medicine, it may make their blood sugar too low, or it may cause hypoglycemia.
Okay.
So we always make sure before Cricket gets her meds, she did eat a full meal. You were like hunting something, huh? I didn't see it. You're just hunting the next kibble. She's just like in full pounce, the tail
Oh,
swishing.
is she?
She's ready to hunt.
She's like, I know you put something in here for me.
Right.
It's not dinner time yet, Cricket. You got a couple hours. Poor thing. So, and are we feeding her like a special diet for this? Is it like a prescription diet?
Yeah. So we're giving her a prescription diet called BM, stands for diabetic management. The key with a lot of these diabetics, particularly the type 2 guys, and in people and in cats, we try and feed them something that roughly is high in protein and low in carbohydrates. So with these guys, again, glycemic control, blood sugar control is key. If you eat lots and lots of carbohydrates, it makes your blood sugar go up. And as a result, you need more insulin, you need more therapy, and you feel sicker. Proteins, they can get turned into blood sugar, but cats being carnivores, they can use them for energy a little more directly than we can. So we try and feed them something high in protein and low in carbs so that we keep their blood sugar a little bit more consistent. And with regards to being a prescription diet, that's about the big difference there. It's high in protein and low in carbs. So you wouldn't necessarily want to feed that one to a growing kitten, but other than that, there's nothing really like medicated about it. It's the balance of the diet.
Gotcha.
If you were to feed her like a home cooked diet that is formulated, it's balanced for cat, but is a higher protein percentage, 40% protein and a lower carb, that would also be appropriate. So that's really the gist behind it.
Yeah. So it's a healthy diet, just getting something that is good for her for her levels and everything. I was laughing just then, by the way, because I think she's sniffing near the microphone. If you can hear it.
I was worried she's going to turn the meeting off. She's right near the back button. I'm like, uh-oh, if we may get cut off by
the meeting, we'll come back.
Yeah.
You can hear her sniffing near the microphone. It's really funny.
Yeah.
I love this.
Yeah. It's an excellent question, though, because diet management with these guys is huge. Dietary management of diabetes is a major prognostic factor when we look at who's likely to go into remission. Good dietary control from the start typically yields much better results. They're either easier to manage, or we can stop their insulin, or they do better for longer. So diet management, just like you do for people, is a huge part of taking care of these guys.
Super important. Okay. Healthy diet, Cricket. You got to stick to it. So we were talking, so obviously feeding her, that's easy. Anyone can put food in a bowl. I know some people might get really nervous or scared when we talk about giving a cat an injection, and she has to have it twice a day. So I can talk about my experience doing it as like a first timer, but I'll let you go first. Like, how have you experienced just giving injections in general? I know you're an expert at this point, but is it hard? What do you think?
I think most people would be surprised in that when we're talking about medicating a cat, overwhelmingly, I would pick injections over oral medications, like pilling them, and that it's much easier to poke them than to trick them into eating things. So I usually think it's much easier for a lot of these guys. Typically, you're going to go right in the subcu space right here. Kind of have them just pinching and lifting up, and Cricket doesn't mind at all. This space right here is where you poke her with a needle. So you can see that pinch that I did, the needle is usually a 29 or 30 gauge needle. It's an insulin syringe, just like people use. It's so small, it's like a little bug bite. So if you can pinch her skin like that and pick it up, you can probably inject her much, much more easily than you think. So it's a pretty simple process. And then I'm all about bribes. I think with these guys, it's better if they don't know what I'm doing. So again, particularly like if I have to give a dog a vaccine and I'm all by myself, I'm not above just putting like a big smear of peanut butter on the floor. I will let them just eat for my own dogs too. This is what I do in my house when I bring home vaccine. Big smear of peanut butter on the kitchen floor. I can give my dogs like 3 vaccines before they even know I've done anything. So usually for those guys, food for them is a big motivator. So you find what you love, particularly with a hungry diabetic like Cricket. we use food as a signal, and that when she's eating, we typically let her eat her meal, we give her an additional little snack, and while she's eating that, we can poke her, and she doesn't even really notice.
Yeah, I bet she is like, you're sitting in here and you're not giving me snacks.
I know, she's getting so mad at me, and she's like, stop touching my tail. I'm like, it's on video.
I didn't touch your tail. She just wants a snack, man. She's hungry. We have you on tape, Cricket. Well, I think the interesting thing is I've seen videos of her previous foster dad giving her an injection. Literally, like, she didn't even look at him. She just like completely didn't even notice. And that's a good point you make about pilling versus injection. I've never really thought about it that way before, but absolutely. Yes. I think any cat owners out there.
Yeah, it's much harder to pill them.
So hard, but people do it all the time. People pill their cats all the time, but you may not think, like, I think an injection seems so much scarier, and you're totally right. Like, I would way rather have to give a shot than pill a cat. And so for those of you out there who are like, I've never done this before, that sounds so scary. I have worked in the field for almost 10 years and somehow didn't end up giving up animal a an injection until like last year. Don't know how that happened. And I was so nervous. Like, I was so scared to give that kind of shot. And then when I did it, I didn't even realize I'd done it because it was so easy. I remember looking at Christina, one of our coworkers, and just saying like, wait, is that it? And she's like, yeah, you're done. I was like, oh, well, that wasn't hard at all. Like, it's so easy. I think the most important thing is just kind of keeping to a schedule, right?
Yeah, exactly.
For their insulin, yeah.
But typically for these kids, we do want you to try and give their insulin on a semi-regular basis, meaning like 12 hours apart. So for Miss Cricket, sorry, bathroom break. For Miss Cricket, we're feeding her at like 7:30 in the morning and 7:30 at night, fairly consistently. So she's getting her insulin between 7:30 and 8 o'clock every day, pretty regularly. So for them, like, that's the tough part in that. Yeah, schedule-wise, we do want you to try and do like a pretty consistent breakfast and dinner and insulin at the same time. It doesn't have to exactly be 12 hours. I've had a lot of clients where like, okay, the cat's going to eat at like 6 a.m. and 7 p.m. and that's what I'm going to do. And that's close enough. So as long as it's, spread out, you have a morning and a nighttime dose. I'm sorry, you done? No? You're not on to do more? Okay. So
I love doing interviews with animals.
So typically for these guys, so we'll have them do a morning dose and we'll have them do a nighttime dose. So again, just try and do it roughly the same time every day for consistency.
No one's going anywhere right now. So super easy, right? You're home all the time. It's not a big deal.
Vacation, sure.
I am just thoroughly entertained by this. Also, I hope everyone just loves the fact that this doesn't bother either one of us. We're just like, we deal with this every day.
That was pretty normal. So when I think about diabetic control, it's like, oh, it was a small amount, good for it. I know it's
weird. You did good, Cricket. Yay.
Yeah.
So I keep getting so distracted. She is so funny. So I guess the next question we get all the time about insulin is cost. Now I know it costs different for us because we're a shelter than it might for the general public, and there's different types of insulin. So just specifically for Cricket, can you speak at all to like just what you think an average like monthly cost might be for her?
Absolutely. So for Cricket to buy one vial of insulin and to buy about 100 syringes, it's about $30 for the vial, and it's about $30 for 100 syringes. 100 syringes will last you about 50 days, so it's like a month and a half.
That's not bad at all.
Yeah, the vial is about 10 mils. Cricket gets like 0.02 mils, about like 0.02, 0.03 mils twice a day. So the bottle usually expires before we can use it all up. So the vet's like, it's supposed to, you use it for about a month. We can stretch it a little longer than that if we keep it in the fridge. So for her, on a monthly basis, you're probably looking at like $50, $60 shelter cost.
Okay.
And when you take her home, you don't necessarily get medications that cost, including the markup. I'm sorry, yes, it is.
No, your phone's vibrating. It's okay. So I'm just going to repeat, just in case anyone missed it. So you were saying for the shelter, it's about 40 to 60 a month. But
exactly.
Okay.
So
but you were going to talk about markups for vets, right?
Exactly. So honestly, most pharmacies and most veterinary we are businesses, so like we don't aim to necessarily profit lots and lots of medications, but in order to keep the lights on and keep the staff employed, we do have to make a small amount of money. So I'd say with a markup, reasonably, you would plan on spending about twice that. So, something
Okay.
about like $80 a month for her treatment would be not
Okay.
unreasonable. But again, it would be something that would cover you for probably more like a month and a half. So it wouldn't
Mhm.
be necessary. You're not talking about, you have to spend $5,000 a year on her.
Yeah.
Diabetics typically, their insulin costs over a year. Again, arguably that should be probably something about like $600 is not unreasonable, because
Mhm.
most of the equipment and most of the medication, you don't need to renew it monthly. You can stretch it out a little further than that, depending.
Right. And that's, I think actually a lot of people might be surprised. I think some people think it's going to be way more than that, because you hear, I mean, it's, we're not going to get too much into the politics of it, but you hear, oh, there's a lot of issues with insulin costs for humans. So I think it sounds kind of scary, but yeah, I mean, that's really not an unreasonable
Right.
amount, I think, for some people.
Sure. And that's the type that we're using, the veterinary
Hmm.
type. The human medication, the human insulin, there are a couple ones like Lantus or Glargine insulin that also works really, really well for cats. Again, the main reason we're not using it is cost. So with us,
Hmm.
again, it would be expensive for us as well. When I was in private practice, I would prefer to use that one because the results are a little better. But
Hmm.
again, for other purposes, for the response I'm seeing in our patient cricket, she's doing just fine with this one. That's a little bit more cost effective
Awesome.
and geared specifically toward the animals. So
Hmm.
for her, I'd say, like, again, that would be, thankfully, I think it'll save you some money that she's doing well on that one. So
Awesome. And are there any other sort of things that an owner who has a diabetic cat should expect that they would need to do? So, you got your shots, you got your special food. Is there anything else that they would kind of need to know about just kind of keeping her in good health through her life?
sure. So with a lot of these guys, we do recommend doing a blood glucose curve when they're stable. We usually do it every like 6 months or so, so twice
Okay.
a year. A blood glucose curve means throughout the day, in between her insulin injections, every 2 or 3 hours, we check her blood sugar.
Okay.
What we can do with that information is that we can actually graph it out and make sure at certain time points during the day, we should be able to predict what is Cricket's blood sugar about going to be, when is the low point, when is it the lowest, is it coming back up around the time she's due to eat again. And based on those blood glucose curves, we can tell you, is she getting the right amount of insulin? And over time, right now we have her at 3 units twice a day, which is appropriate for her size. You may need to adjust. You may need to go up or down, and that if she
Hmm.
loses a bit of weight, she may need less. If she, let's say, we're at a shelter, let's say she gets an upper respiratory infection, she gets a cold. During that time, she may need more insulin because that may make her insulin resistant. So blood glucose curves are super, super helpful whenever you're trying to adjust their insulin, because it can tell you, do you need to go up or down on it? Normally, or at the shelter at least, the way we perform that is just by getting little blood samples by poking her ear. We can teach
Oh.
people, we can teach adopters to perform these at home as well. So again, when we're looking at cost, if you're able to do a blood glucose curve at home, you can save yourself a pretty substantial amount of money depending on how much time you have to do it, and that you're doing, the collecting of data. And most
Hmm.
vets will interpret those numbers for you at a nominal fee. So rather than an
Nice.
exam, and we're going to keep her for the day, so have hospitalization, and now we need 6 blood
Hmm.
glucose curves. For a lot of our owners, like if you're able to do it at home with her, that would be something, again, you can arguably save a fair bit of money and send us the numbers. And again, like we would much rather treat your cat than send you a bill. So for most of us, like a nominal interpretation fee, like
Yeah.
$30, $35, and then we'll tell you what to do with the insulin. Is usually
Yeah.
how we would approach it.
And
The
if you
other,
can give her an insulin shot, you
right.
can probably poke her in the ear, right? Like,
So the other really cool thing, so on the human side, they're starting to use a lot more of the insulin sensors or the blood glucose sensors. So you may have seen, you can actually take, it looks like a little plastic square, and you put
hmm.
it right on your skin, and there's a little plastic catheter that goes into your subdermal, into your fat tissue, and
Hmm.
we can take blood glucose readings from your tissue and essentially do the same thing. So we found there are some ones that are small enough, you can actually shave a little patch over their shoulder, and you can actually glue it right onto the cat. And for them, you can do, so
Cool.
the nice thing about that is now you don't have to poke your cat for blood. You have an app or a reader. You can scan your cat and get a blood sugar reading.
Oh,
So those are pretty cool. So
futuristic
now
cats.
they're there's a lot of internal medicine doctors on here with very difficult to manage diabetics. That's how they'll do it. So now I don't have to poke your cat 15 times today. I can take my phone and wave it over them and tell you what their blood sugar is.
That's
So
awesome.
that's a cool thing that's come out in like the last year, and that we've been able to adapt some of the human technology to cats.
Yeah.
So
So there's options for like the
absolutely.
owner, you know, they
Yes.
have kind of ways they can go that whatever
Absolutely.
works best for their pet.
Exactly. Yeah. If getting blood seems a little too much, your vet can
Mhm.
your vet can usually help you by putting this sensor on your cat. You can take readings over a period of 2 weeks,
Cool.
and then they'll remove it for you when the sensor's used up. So
That's so cool.
yeah,
That's what I would need if my cat
yeah.
had that, because
It makes your
you
cat kind of look
know.
like Iron Man. You have like a little implant. So it's just saying on the skin, but yeah, it makes them look like a little bionic kitty.
That's
So
so cool.
yeah,
Well, I mean, I think it's awesome just to talk about this in general. I think just talking about it more and just normalizing it. Really, we just want people to know it's not as scary and daunting as it sounds. And you know, I hope people out there know they can totally ask us questions if there's anything we didn't answer today. Feel free to post your, you know, questions in the comments. I will ask Dr. Galati to answer them for you. I guess, is there anything else we should know? I mean, you know, we can talk about Cricket a little bit, just about her. You guys have really seen her amazing funny personality today, which I love. She's such a goofball.
I was gonna
We
say.
are gonna she's still grumpy that she doesn't have snacks? She's just waiting by her snack bowl.
What? Yeah.
Oh,
She's looking for something better to come by.
this
Where's
guy
that lady
is
with the temptations?
not giving me any treats,
Her
so
tail.
someone else.
Well, you can see how she's doing the grumpy tail because I didn't feed her. So she's like, I'm so annoyed right now. I can't. This guy's just
You
not doing
guys,
what I want.
she's not
I'm
a
over
total
this
grumpy
interview.
butt. She's
But
actually
no,
very sweet and cuddly and
she's
cute.
super sweet.
Her foster dad sent us all these pictures of her. Like every time he sat down on his couch, he would just like
Yeah.
jump straight into his lap and like lay and go to sleep. She's so
Oh
sweet.
no. She comes over and
And
she's doing that a little bit, but then when I don't feed her, she's like, never mind.
oh,
So
she's hungry. Well, and we're gonna throw it out there too. Kale, you know, the reason we do these videos is, you know, on top of just making sure people feel informed, is diabetic cats are usually one of the longest stay cats in our facilities. It takes a long time for them to get adopted, and she's been here, I think we looked it up right before we did this call, she's been here since
months.
March.
Yeah.
So she has been here since the start of this pandemic, you guys.
I think we got Cricket in, and then I think a week or two later we got the word from the governor to shut down for a bit. So she was one of our last admissions before the pandemic.
See, that puts it into perspective how long she's been in our shelter. And she, you know, she deserves a home, and hopefully answering all these questions just makes it a little easier to understand and a little less daunting. So like I said, feel free to post any other questions you guys have below. If you want to meet her, let me know. I'll hook you up to meet Cricket.
Absolutely.
And thank you so much for chatting with us today, Dr. Galati. I really appreciate it.
No, absolutely. Good talking to everybody.
Awesome. All right, guys. See you later.
You are curious.
She's a funny little thing.
Yeah. So
Oh my gosh.
it's probably there is some relation to the diabetes can cause.
Hi, Dr. Galati.
You found a kibble. That's what it was. She found a kibble. I told you she was hungry.
Food back there?
Yeah. Want to help? Is it under there? You get it? Watch your head. Is that why you were
Hilarious.
angry?
There was food. That's why she was grumpy, because she knew there was food and she couldn't get to it.
Are we good now?